Good afternoon and welcome to the fourth session in the TPP Hospital webinar series showcasing the modern EPR. The main aim of this series really is to showcase how TPP is supporting the frontline digitisation requirements for NHS trusts through the SystmOne Hospital EPR and show how our future-proof platform has been designed to meet the changing demands, pressures and priorities of care delivery in the NHS. The SystmOne Hospital is an out-of-the-box, enterprise-wide solution. It includes all the following modules. Obviously, today's session is specifically about the SystmOne Maternity solution, which provides maternity departments with functionality to support appointment management, thorough patient monitoring, and consistent integrated care for the duration of the pregnancy. SystmOne's maternity module includes a number of specialist capabilities to support clinicians in effectively managing maternity wards and delivering the best care. Our maternity solution is something we're particularly excited about at the moment, as we recently went live in Torbay and South Devon Foundation Trust. The system has really enabled the trust to digitise their entire maternity pathway from antenatal through to postnatal care. It's been used by all midwives in the region, including those based both at the hospital and those working in the community. More than 2,500 women benefit from the new system every single year, with their maternity care now centred on a complete integrated digital care record. Following the go live, midwives will now have instant access to all the maternity data they need. For example, midwives working in postnatal care can easily view all antenatal care and delivery details. All medical and nursing notes are captured in a single record, providing information required to make the best clinical decisions and improve safety for mothers and babies. Advanced functionality in the system is also supporting staff for the management of more complex pregnancies through enhanced decision support, alerts, and a complete maternity timeline. The Go Live has also included providing TPP smartphone application AirMid to all women on maternity service, putting women at the very centre of their pregnancy journey. AirMid allows women to access their maternity records, view their upcoming appointments, complete questionnaires at home, and receive personalised advice and education material. Now, obviously, we've not got loads of time today, so if you do want to see anything in more detail or are interested in any of the other modules, we'll be hosting more sessions and we've got recordings available for previous sessions. These dates are booked in so far, but there will be more to come. The links can all be found on our website, or you can drop me or anyone else from TPP an email and we'll send over any information. Thank you. And I will hand over to Rich.
The deployment of SystmOne, in combination of the utilisation of the patient app AirMid, provides a comprehensive platform to manage all stages of the maternity journey, supporting mothers at home, in the community and within the acute setting, whilst capturing the relevant data items for the maternity services dataset extract. Hard-coded functionality can be used to support admissions, discharges and appointments, alongside all the required data capture, which can be guided and localised using features of the Clinical Development Kit. This enables the Trust to design and maintain locally determined user processes, structured data entry, and clinical decision support. We are going to cover our maternity functionality following a common maternity pathway in today's session. The pregnancy dialogue is used to capture details during first contact with the patient. Most of the drop-down lists are configurable. Hard-coded lists have been predefined to capture required codes for the MSDS extract. The folder icon next to the date field enables the user to pull that date from the patient record. An estimated delivery date is auto-calculated, and it also tells you what that date is based on, i.e. the LMP. The asterisk icon next to the location can be used to select from a locally configured list of frequently used locations. The user completes the screen, which created the pregnancy and generates a pregnancy ID. The Trust can configure SystmOne's visualization functionality to summarize key information in one place. Here we can see a visualization summarizing historic pregnancy information for this particular patient. Once a pregnancy is recorded, a fetus is automatically created. You can use the Add Fetus button for recording twins and then can assign data to the fetus. Diagnosis codes and numeric results recorded against the fetus will then be automatically added to the baby's record, which gets created after the delivery. With permission in place, access to the shared medical record means that users will be able to see a rich medical history, including data captured at other SystmOne organisations for their patient. To make the best use of this information, a visualisation of the current pregnancy could be configured to display relevant data in one place. Visualizations can be used to display alerts, management plans, instructions, and quick access links to related activities. Using the CDK, the Trust can configure or download existing content from the resource library in the form of questionnaires or data entry templates. This will provide all the assessments staff need to complete, including telephone triage templates and risk assessments. This is an example of a simple data entry template used to quickly gather key screening information. Template fields can be set as recommended and mandatory fields as per the Trust requirements, and can contain passive decision support in the form of intelligent information boxes and hyperlinks to additional guidance if required. Protocol functionality is one of SystmOne's active decision support tools, and these are hugely configurable to achieve a vast array of prompts and guidance. For example, protocols can be developed to remind users to complete relevant tasks at appropriate time, alert users about risk factors, or remind them to complete risk assessments. As we know from the Ockenden findings, it can be easy for risk assessments to be overlooked, which can have significant consequences. Protocols are powerful tools that can be utilised to ensure staff are alerted and prompted to follow best practice processes to achieve the best outcomes. In this case, a protocol has been identified. Information by running checks on the patient in the background is now alerting the user that they must take the appropriate action. In this instance, it has determined that they must alert another team about an identified high risk and displays a predefined task template for the user to send. This kind of automated warning and escalation process provides invaluable support towards meeting actions set out for maternity teams in the Ockenden report. Here you can log care and birth plans for the patient. A responsible person can be recorded along with the planned delivery location. The data captured here is required for the MSDS extract. If you wish to capture further information, you can also use some of the CDK tools we showed you previously. To log all the healthcare professionals involved, SystmOne contains various functionality which you could utilise, including referral allocations, which we're looking at here, caseloads, and relationships. All of this information is recorded against the patient record and is viewable at a glance. The pregnancy flag is visible in the patient's demographic box. It is automatically added when the relevant pregnancy codes are recorded and removed when a birth loss is subsequently recorded. Flags like these can be configured using SystmOne's patient status alert functionality. From the visualization, quick actions can be configured to complete and record tests, such as the carbon monoxide, urine, or FBC tests. The patient's vaccination history is easy to access either by navigating to the record or via a quick action button. It can include vaccinations given at their GP if you have access to the shared record and other services. If you need to record a new vaccination, this can be done by completing the new vaccination details or by selecting from a predefined vaccination template. Vaccinations can also be deducted from current stock so you can monitor levels easily. The maternity activity timeline represents everything that should happen from when a pregnancy is recording up to the expected delivery date. You can right-click on an item to see the journal entries in the record on that date, which you can print from here if needed. As we scroll across, you can also right-click on other items to access things like appointment information, and you can also see any linked letters. Users can easily see what has been completed and what is outstanding, as well as what is due. To assist with department planning, patients can be added to patient tracking lists. These can be locally configured with custom target dates set. Appointment clinics are set up by permitted users and are managed by creating and applying templates for each rota. Here you can see an example clinic which has some appointments booked into it. To book an appointment, you can simply select an empty slot, search for your patient, and add any details about their appointment. Bookings can be dragged into other slots to make quick adjustments to the diary. With the correct permissions, the user can block out slots if they need to, and depending on the config, extra slots can be added to at the start or the end of the session as needed. It's also easy to amend the clinic in terms of time or date and the hosting clinician. As you can see, we've swapped this clinic from Rachel to June very easily. It is also possible to utilize the bulk actions option to quickly inform all of the booked patients at these changes to their appointments, such as by sending them all an AirMid app notification or an SMS. Bulk actions include various patient communication and clinical entry options, which can be performed rapidly for large numbers of patient records. To ensure patients are seen when they should be, clinical reports can be created to identify any patients who have missed appointments so that remedial action can be taken. Another crucial finding of the Ockenden report. The bulk action tools can be used to carry out relevant activities such as sending letters or messages, or even adding alerts to the list of patients that have been identified. When it comes to performing routine home visits, the autoplanner functionality can be used to reduce the burden of scheduling all those required visits. This functionality enables a user to rapidly identify all the patients on a caseload who will require a visit performing and automatically assign them to the most suitable staff member based on an algorithm. You can customize the weightings of this so it takes into consideration your preferences around booking decisions, such as booking more visits on fewer staff members or reducing time spent traveling. The result display like this so you can see who is going where, and if you're happy with the results you can choose to save them, which automatically books all the appointments in. When it comes to performing appointments, they can be done remotely using AirMid video consultations. On the left, the patient joins a call directly from their booked appointment on the AirMid app on their mobile device. On the right, the clinician joins a call from their appointment clinic and it opens in a new window. This means they can display the patient's record on another window or monitor so they can review and update this during the call. Here we can see a patient is being booked in for an elective section. They are shown in the ward view here as an expected arrival, or TCI, where they can be admitted and then moved into a bed. When admitting patients, the system can print wristbands if required, and the user can drag and drop the new patient into a free bed. The beds are configured as required and can be set up to represent your exact layout. We have set up 4 beds on this ward. You may have private rooms and birthing pool rooms. This is simple to configure within the system. When the patient has been admitted, we can clearly see any to-do list items, which have been automatically recorded for the patient as part of the locally configured admission process. The example here is that the patient has automatically been added the to-do list item for midwife assessment. We are currently looking in Ward 10, the maternity department, where we can currently see all our patients that have been allocated to the appropriate rooms. The user can also apply something called ward view filters to identify specific patients, such as those with a latex allergy. You can see how easy it is to simply filter the screen for those particular alerts that are added to the patient records. These alerts, like lots of different parts of the system, can be configured to meet your requirements. When a patient begins progressing through labour, users can capture key labour information required for the MSDS. This screen includes fields for the user to record timestamps for each stage of the labour and will display automatically calculated durations as each stage progresses. A useful status icon indicates whether all the required data has been captured, either partially or fully. We can see this now on the right-hand side of the screen. The user can then log the outcome. The details required are based on data needed for the MSDS and allow information to be recorded about live and stillbirths as necessary. Just so you can see it, when recording the outcome for a multiple birth labour, you can see the user must record the birth order and link the outcome to the correct fetus. Linked diagnosis codes are displayed to assist with correct logging of birth order. These are mandatory fields as the data is required for the MSDS. Back to our scenario. As we've recorded a live birth, the system is now prompting to create the baby's record. All information recorded for the fetus will now populate onto the baby's own new medical record. An NHS number will be generated for them and their record is automatically linked to their mothers. Another application of the CDK can be used at this stage to provide users with a postnatal visualization, helpful for ensuring all the assessments and checks have been completed before discharging mum and baby. Again, actions can be linked to these fields in the configuration so that users can rapidly access relevant assessments and tools. This configuration example includes quick link buttons for onward referrals at any stage. The patient can refer to other departments or services. A reliable ward overview is crucial for the management of such busy and constantly fluctuating department. SystmOne provides various locally configurable solutions for this. Various maternity dashboards can be created, like this example, as a department overview for staff and managers, providing key statistics in real time. These can be built to alert relevant staff if defined threshold levels are reached, assisting managers in quickly responding to changes on demand of the ward's resources. In addition to this, the smart card could be used as a more detailed department overview, similar to a conventional whiteboard. However, this automatically displays real-time clinical information for the admitted patients at the selected location, as well as any patients due to be admitted there. Users can choose from different versions of smartboards built by the Trust and can sort the patients listed by any of the visible columns. This one includes more columns for the to-do list items, so you can quickly see due and outstanding actions, as well as various colour coding, which has been configured to appear for various staff. AirMid is designed to support the women through their pregnancy pathway, bringing them closer to clinicians and giving them control of their healthcare needs. The AirMid app gives users access to their full medical record, reduces the need for face-to-face appointments, and it provides details of local healthcare organisations, allowing you to exercise more control over your personal health, while reducing the time that you need to spend on it. Bridget is an app for clinicians using SystmOne. It allows you to easily access key patient information such as demographics and clinical alerts. You're able to view a patient's record, adding notes that are immediately visible in both Bridget and SystmOne. It will allow you to instantly send bidirectional messaging between clinicians and teams. It also supports templates and questionnaires, patient messaging, appointments and access to calendars, and also remote working. Bridget also allows you to schedule, record, view, and escalate patient observations. In this example here, we're showing how you can complete the meows. SystmOne's maternity module has an integrated MSDS extract to report on all the maternity care dataset. All clinical conditions can be recorded using SNOMED codes and are therefore reportable. The Trust is able to configure all the CDK items available to ensure that the data required for the Maternity Record Standard PRSB and Maternity Services dataset can be captured, and where appropriate, staff are prompted or guided to record specific data, helping to improve and record data. To give you an idea of how easy it is to build a clinical report, here you can see I've simply selected the EDD date range and calculation method from the list of available criteria. This report will now allow me to identify all the patients who have gone past their expected delivery date. Once a report has been created, you will then be able to see the report. You'll be able to then run the report to find out results of the information you were looking for. It's then very simple to be able to show the patients that are being created in that report. By simply right-click on the report, we can then select the option called Show Patients. This will then clearly display all the patients who were actually included in that report. From here, I can also then have direct access to their patient record by simply right-clicking on the relevant patient. As well as identifying lists of patients who meet the specified criteria, reports form a vital part of the CDK by enabling CDK items to be triggered or displayed for suitable patients. This can include triggering protocols, updating stats on dashboards, sending out recurring AirMid app notifications, and updating patient status alerts. Other options I may want to do is create patient status alerts linked to my particular report. You'll be familiar with the use of stickers on patient records to instantly identify crucial information. For example, for patients who may have had a previous loss. Our status alerts functionality allows us to achieve this. It can be configured by selecting a report to identify patients and then defining the alert that should be automatically applied to all those relevant records. It can also contain a quick action link if there's any associated activity to perform alongside it. Once you've created the patient status alert, you will then be able to simply see in all those patient records, the alert will be clearly visible. Here's the example of the two patients who have that information in their record, and we can then clearly see the patient status alert is then highlighted when accessing their electronic medical record. So thank you very much. That concludes our maternity webinar today. I hope you enjoyed seeing the different parts of functionality we have within the system, and we look forward to seeing you on some of our next webinars in the coming weeks. Thank you very much.
Good afternoon and welcome to the fourth session in the TPP Hospital webinar series showcasing the modern EPR. The main aim of this series really is to showcase how TPP is supporting the frontline digitisation